Tired of recurring UTIs and being prescribed antibiotics? Today we're going to dive in deep with natural remedies for UTIs and how you can prevent and protect yourself from them. Hi, I'm Stephanie Grutz, aka The Healthy Practitioner, board-certified family nurse practitioner specializing in integrative medicine. I've helped hundreds of women with the hormone issues and general health issues, including UTI support. We're going to talk about natural science-backed remedies to help you prevent and protect your bladder from UTIs. Let's dive in. So what is a UTI? A urinary tract infection, aka UTI, is when bacteria, especially E. coli, are on the bladder wall causing infection. Women are 4 times more likely than men to experience a UTI because of their short urethra, especially women that are elderly. I worked in the nursing home prior to what I do now, and there were tons of UTIs in elderly population. So your parents might struggle with this, grandparents. A lot of times it's, due to poor wiping, and the E. coli from the rectum comes up to the vaginal area and creates UTI and infections. So what are the common symptoms of UTI? Frequency with urination, burning with urination, fever or low back pain, blood in the urine, or cloudy or strong smelling odorous urine. Pelvic pain or discomfort can also be a symptom. The top natural remedies that I use in my clinic every day for UTI prevention and treatment: D-mannose. Fleck Balance, we have a supplement called UTI Support, and that has D-mannose in high doses. So D-mannose is a natural occurring sugar that protects and it binds to the E. coli so that it doesn't stick to the bladder wall, and then it doesn't cause infection. So it's really good for treatment, but great for prevention as well. Especially for anybody that is at risk for common UTIs, I give them UTI Support in the D-mannose to help with that. Typically, it's between 500 to 1,000 milligrams daily for prevention, or if you're going through acute symptoms, anything that I just named above, I do 500 milligrams every couple hours for at least a day to see if we can wipe it out. Cranberry extract, not the juice, is another great way to help prevent UTIs. We all hear about cranberry juice when someone says UTI, but it's really the proanthocyanins, the PCACs, inside the cranberry that actually helps attach to the bacteria and decrease risk for UTIs. So in order to drink enough cranberry juice to help get enough of these nutrients, it's way too much. So just skip the sugary drinks. They just don't contain enough of the PACs to actually make a big difference. Next, stay hydrated and have a great urinary pH balance. So staying hydrated helps flush the system and prevent the bacteria from sticking to the bladder wall. I like to do salt, like pink Himalayan sea salt, daily, 1/2 teaspoon to help with the electrolyte absorption of water. Like, it's just a natural, cheap mineral source, or you can use minerals as well. And then just regular water for flushing and hydration. Lemon water or apple cider vinegar can help maintain a slightly alkaline pH, making it harder for bacteria to live and thrive. So let's say those are really great for prevention and for like the acute onset of UTIs, but let's say it's starting to get a little more significant. You've had the symptoms for 24 hours. Uva ursi is a natural antibacterial herb that is really helpful to fight E. coli. Berberine is found in golden seal, and that's really a great antimicrobial as well. And then marshmallow root and corn silk can help decrease the irritation to the bladder lining. Probiotics are really great. So a lot of times vaginal, bladder, and gut health can be due to imbalance of good microbes. So having good probiotics to either do vaginally or orally can help adjust the health of the bladder wall. So what foods should you avoid if you have a UTI? Caffeine and alcohol irritate the bladder, worsening symptoms. Sugary foods, and then like holding your urine and bladder can actually help harbor more bacteria. So don't hold your bladder, and also don't wear tight fitting underwear as well, because that can trap moisture, creating more bacteria. When might you need antibiotics? So let's say you're doing these at-home remedies for 3 days or 72 hours and you're still having symptoms. Definitely go get a urine sample, get it cultured, and see what's growing. 2, if you're pregnant, don't mess around with UTIs. At least go right away and get a urine culture and see what's growing in there. If you're having severe pain, nausea, vomiting, back pain, blood in the urine, it could indicate a kidney infection, a more severe infection, so you want to get that tested as well. My advice is to always get a urine culture. Sometimes they'll just do a dip, a urine dip, and see if there's nitrates and leukocytes on the dip. But getting a culture can actually show what was growing, and then it will show antibiotic sensitivity, which as a provider, it's best practice for me to know what antibiotic is going to treat the urinary tract infection. So I always recommend getting a culture with your urine. UTIs do not have to be a constant struggle. These natural remedies can help you prevent and fight off mild UTIs without having to jump to the antibiotics that, as you know, cause other side effects and potential long-term harm to the gut microbiome. So be safe, have fun. If you like this video, give me a thumbs up and subscribe for more health and healing tips. See you around.